Good morning, everyone, and welcome. My name is Alison Hoons. I'm an affiliate knowledge broker at Arthritis Research Canada and a member of Arthritis Research Canada's Volunteer Arthritis Patient Advisory Board. I'm thrilled to be your moderator for this morning's webinar and excited to learn from our guest research scientist, Dr. Diane Lakai. This webinar is being presented in support of episode number 6 of the Arthritis Research Education Series, Making It Work, Employment and Arthritis. The research featured in this episode addresses solutions to the huge personal and societal impacts of arthritis on working individuals. If you're joining us today for the first time, the Arthritis Research Education Series was created by Arthritis Research Canada's Patient Advisory Board. The purpose of this series is to provide an in-depth look at specific areas of research and to share important, new, and relevant research with patients and the public. Many of you have already viewed the video for this episode on our website, but if you haven't, that's okay. We're going to play it later for you in the question and answer period. This morning, we're delighted to have our featured researcher, Dr. Diane Lakai, here to give a short presentation on her work. After the presentation, we have set aside time for your questions. Please click on the Q&A button, which is at the bottom of your screen in the lower right side, and you can type in your questions. There's no chat function for today's webinar, so you'll see the button that says chat, but we would prefer that all questions be put into the Q&A. So just click on Q&A and you can feel free to type in your questions. We'll do our best to answer as many of your questions as possible. And for those that don't get answered during this live session, we'll post the answers on the resource page of episode 6 on the website. Understandably, we will not be able to answer questions related specifically to your own medical treatment, as medical advice requires detailed information and clinical assessment. So it's my pleasure to introduce you to Dr. Diane Lakai. Diane Lakai is a professor of medicine and Mary Pack Chair at the University of British Columbia. And she's the scientific director of Arthritis Research Canada. She's pioneered research using the massive routinely collected data that our health system collects to improve the quality of care for patients living with arthritis. Dr. Lakai's research is on the issues faced by and solutions that can be used by arthritis patients in getting and staying employed, and it's recognized worldwide. She developed the first comprehensive program to prevent work disability in people living with inflammatory arthritis, aptly named Making It Work. And it's filling an important and unmet need in services available to people with arthritis. So without any undue delay, I would like to turn over the presentation to Dr. Lakai.
Well, thank you, Alison, for the kind introduction, and thank you for the opportunity to share my research with people attending our webinar today and in the future, watching it on our website. It really is something I'm very passionate about. It's a program that I've worked on for many, many years, and it's a pleasure for me to be speaking about it today. Just going to pull up my presentation. Sorry, there we go. All right. So Making It Work, what is it? It's a program online to help people with inflammatory arthritis at work, and I'm going to tell you a little bit more about it. First, what problem does it address? Well, you can imagine that living with pain and fatigue can make it hard for people to complete their tasks at work. And in fact, arthritis is the most common health reason why Canadians have to stop working. And people with arthritis tell us that support for staying at work is really important to them and is something that they're not getting very easily within the healthcare system. There are few health services which are designed to address work issues. And most of these are what we call vocational rehabilitation programs. And those tend to help people who've already stopped working in order to help them return to work. And the success is limited because waiting until people have stopped working is too late. What we need is to intervene earlier while people are still working to prevent work disability. This is a much more desirable approach and goal. I also want to point out that the extent of this problem at a national level, that arthritis costs the Canadian economy an estimated $33 billion per year in lost productivity and healthcare cost. So obviously this is something that matters to people who live with the disease, but it is also something that should gain national attention at the societal level. So a solution to this problem is the Making It Work program. And the goal of the program is to support people to remain employed, but not at all cost. Also, to really support people in leading healthy and productive lives at work. Our program is unique. It was developed for people with inflammatory types of arthritis who are currently working. And how does the program achieve this goal? It teaches people how to modify the risk factors to prevent work disability, to deal with the challenges that they encounter at work due to their arthritis. And we focus a lot on what can people do to adapt their work to their arthritis. The program was developed through a comprehensive and rigorous process that was the program was designed by a panel of experts, and it included input from people with arthritis throughout the development of the program. We use what is called principles of self-care, where people are empowered to make changes through gaining awareness and new knowledge, awareness of how their arthritis impacts their work, and knowledge on how to address these. Talking to other people who face similar health and work issues. There's a lot of value in learning from one another and having one's issue validated by having other people living similar things and sharing this. Gaining self-confidence in people's ability to work. Learning and also practicing new skills and technique. It's not just about knowledge, it's also about skills and techniques. And finally, using an approach that is called taking a problem, solving it, turning it into a goal, and then developing an action plan to solve that problem. And also learning about resources and services that are available to people. The program consists of 5 e-learning modules that cover a variety of topics, but things such as the treatment and the self-care for your arthritis, helping to reduce fatigue at work, because when we conducted some focus groups or some discussions with people living with arthritis, they told us that fatigue was the problem that most limited them at work. So we devote an entire module on that. Controlling stress at work and learning strategies to deal with stress that also at the same time help with fatigue and pain. How to have conversations at work about your arthritis and about getting the support that you need, including issues of disclosure, which is the if, when, and how of talking to your employers or your coworkers about your arthritis. And finally, we focus a lot on job accommodations, which are the things that you can do to adapt your work to your arthritis. And some of those things are things you may be able to do on your own, and other things that you may have to ask your employer in order to get help with. There are also 5 online group meetings that occur like a video online meeting, like like what we're doing today, with a group of 8 to 10 people. So people can sign in on these meetings at home, after work, in the evening, and they occur every 2 weeks. So they do a module online, and then they have a group meeting about the module. It's led by a trained facilitator. It's linked to each module, and it allows people to share what they've learned, but also to share their personal experiences at work. And I can't emphasize enough the value of that experience. At the end of the 5-group meeting, there are then 2 one-on-one online consultations with health professionals. The first one is with an occupational therapist to have what is called an ergonomic assessment. And this is when they discuss with the occupational therapist the tasks and the work environment to see what could be modified to be better adapted to arthritis. And this is followed by a consultation with a vocational rehab counselor where they receive some counseling to find ways to help people stay at work and address the challenges that they encounter at work. I thought I'd give you a few snapshots to kind of give you a bit of the look and feel of the program and some examples of what it addresses. So this is a slide about our overall program objectives. And I want to mention that we have characters within the program that keep coming back. And these are all real people living with arthritis. One really important skill is, as I mentioned earlier, the problem solving and goal setting to create action plan. And this is an example of when we explain that technique of taking a problem, turning it into a goal, and then developing a plan a little step at a time to get to your goal. And this is, again, sort of the example of taking a problem and turning it into a goal. So I'm feeling very tired. Then the goal is I'd like to have more energy at work. Another really important key principle that we really emphasize is that work does not occur in isolation of the remainder of a person's life. And I'm sure you can attest to this better than anyone else. And we therefore talk about how everything in a person's life is interconnected, and what happens in one sphere will affect things happening in other spheres. So when we explore potential challenges and solutions, we don't only look at work, we also look at a person's physical and person's emotional health and a person's personal and social life. So for example, I'm going to illustrate this when we discuss fatigue. Fatigue often for people living with arthritis is quite multifactorial, which means that there are multiple issues contributing to the fatigue. So we explore potential sources in the various spheres of a person's life, and then people identify what might be some of the sources of this fatigue. So they will click in the bubble and of the work bubble, and then select the ones that apply to them, and then it'll go into another box, and then they can click there, and then there will be some discussions of potential solutions to those specific issues. So this allows us really to provide content that is personalized to a person's situation, and also is more interactive than just reading about a whole bunch of things on a text. This here is an example of an interactive activity where people evaluate situations at work that may be contributing to stress, and looking in terms of helping people choose one situation they might work on. People work through figuring out how stressful it is, how often it happens, and also, very importantly, how much control they have over the situation. We also use a technique called cognitive behavioral therapy, which looks at how people think about certain situations, because we know that our thoughts influence our feelings and influence our actions. And often, for a variety of reasons, we have automatic thoughts that pop into our brain as a response to certain situations. And sometimes those thoughts are not very helpful. And they can be, when they're examined a little bit more cautiously, they can be turned into more realistic and more helpful thoughts. So this is a technique that we discuss and practice in the program. Another example to facilitate job accommodations, is using the DESO script, which is a communication strategy to make a request when you need to ask something of either a coworker or a supervisor. And this goes through certain steps of describing the problem, expressing what about the situation is a problem for you, specifying what you want to change and what outcome will you think will come out of it if you have the change that you are asking. And finally, we have various videos in our program, and this is an example of a video by a vocational rehab counseling who explains what voc rehab counseling is. And then finally, we've talked about resources. So here are some resources for making job accommodations. So now that you have an idea of the program, I want to now focus on a bit of the research that is behind this program. After developing this program, we did a very rigorous scientific study called a randomized controlled trial, where people are at random selected to either receive the program or receive usual care with some printed information about work, so that we have two groups that we can compare the outcomes on to see whether the program is effective at improving productivity while at work and at preventing work disability. So we tested this program in 546 people in British Columbia, Alberta, and Ontario. People had a variety of the different inflammatory types of arthritis, and they had to be working at the start of the study and being concerned about their ability to work. People were followed for 5 years because this is how long we needed to be able to look at work disability, with online questionnaires every 6 months. And I cannot thank enough the participants for putting up with us and filling out questionnaires every 6 months for 5 years. First, I'm going to talk to you about the results looking at the participation. So trying this out as a trial, when we started this many years ago, there were not so many online group meetings. So one of our goals was to see, is it feasible and do people like it to be doing this online? And we were really happy and satisfied to see that this worked out well. It was possible and people liked it. People did most of the self-learning modules. So we counted the percentage of the slides in each of the module that people completed, and it ranged between 75 to 100%. And we have to keep in mind that sometimes some of the content may not be relevant to a person's situation or disease. Attendance at group meetings was a bit more limited, a bit lower, and it was mostly limited by people saying that other things had come up. There were competing time demands because of things happening in their life, things happening at work, or health issues. And I really have to say that this is not unexpected. And in fact, this level of attendance for this kind of program is actually very acceptable. And then the completion on the consultations with the occupational therapist and the vocational counselor was also very high at 84 and 87%. We also had a feedback questionnaire, and people were highly satisfied with all parts of the program. 94% said they would recommend the program to someone they know. And you can see here, because we were wondering specifically about the online group meetings, and you can see the high satisfaction rates with the different aspects of the online group meeting. Probably the lowest one was around getting to know other participants. We know that's one of the limitations of these Zoom kind of meetings, but people did feel that that was here at 7 out of 10, but people did feel that they were able to participate in the group discussions, which is really important. We also asked people, like a debriefing at the last session, what they had found helpful and what they had really appreciated, and really the increased awareness of how arthritis actually affects their work, increased awareness of their rights and the resources available to them was very, very important. There was some talk about improving what's called self-efficacy, people feeling more confident about dealing with the challenges at work as a result of the strategies and the skills that they learned. People talked about being the validation of the group meetings, of recognizing that their symptoms and struggles were shared by other people, that really provided a lot of emotional support, and being able to connect with other group members was empowering. And although most people felt empowered by this greater awareness, a few actually became frustrated. And this was mainly people who didn't have a lot of control over their work because they recognized what they needed to change, but they were unable to make those changes. And then the results of the trial, looking at the effectiveness, the main outcome was looking at presenteeism, which is reduced productivity while you are at work. And that was looked over a 2-year period, and the long-term work disability, which we defined as a work cessation more than 6 months. And this will be evaluated at 5 years. And we also looked at shorter periods of being off work and days missed or periods absent from work, or absenteeism. So first, this presenteeism. So when you're present at work, but you have reduced productivity because you're unwell. And you can see everybody started the same at the beginning of the trial, and the people who received the intervention had an improvement. So a lower number is better, at an improvement in their limitations at work or their loss of productivity, whereas the people in the control group remained fairly similar. And in addition to that, this here is the cutoff where below that number, people are considered to be at low risk for work disability compared to medium risk. So that threshold is also a meaningful threshold that was crossed in the people who received the program. Looking at work cessation, so this is what we call survival. So everybody is at work, and this looks at the time that you remain at work without having to stop work. And to the left, it's stopping work for a period of at least 2 months, and on the right, it's stopping work for a period of at least 6 months. And in both instances, you see the two curves are separated. You're more likely to remain at work without having to stop working if you're receive the program than if you are in the usual care, and that there's a 35% lower risk when we assess this with some statistical method looking at risk of having to stop work. You see a similar separation for longer periods, but we have less events, and this was not statistically significant, but also a 30% reduction. We also looked at being absent, so days missed, either as occasional days missed or sick leave periods. So in terms of occasional days missed over the entire 2-year period, there were 15 days in the control group compared to 13 days. This is a bit tricky to look at because if you have long periods where you're not at work, you're not eligible for having that outcome. So that's why we also look at it by 100, workable days. And we also looked at a combined outcome where we combined longer interruptions of work with those days missed. And I'm therefore going to jump to these results. So if you look over the entire 2-year of follow-up, people in the control group missed a total of 90 days of work compared to 72 days of work in the program. And per 100 days of follow-up this is, but I think this is the most useful number to look at. And how does that translate in terms of a risk? So if we look at the combined outcome of having to take a sick day or being away for longer work interruptions of more than 2 months, people in the group that received the program were 27% less likely to be absent from work at any given time during the follow-up than if they were in the control group that didn't get the program. So in summary, our program was effective at improving presenteeism. So when people at work, they can work better. It was effective at preventing short-term work cessation. People are less likely to stop working for short periods of time and to be absent at taking missed days from work. not as many sick days and not as many work interruptions. And the effectiveness of the program at preventing long-term work disability will be evaluated at 5 years. And we just have about 1 more year to go before we're able to evaluate that. So, what are the next steps? Well, this program so far has been focusing on people with inflammatory types of arthritis, but we also know that people with osteoarthritis struggle at work and or can struggle at work, not everyone. And it is the most common arthritis. So we're adapting the program to osteoarthritis. We've translated the program into French, and we're also thinking that a lot of those concepts are also applicable to other chronic disease. So we may also develop a more generic version of this. And there's always more we want to add to the program, addressing more issues that we're not addressing. And we're also starting to partner with other countries to offer this elsewhere. And I assume, I often get the question, well, what about when can I enroll in this program? Can I participate in it? It's not currently available to the public because we have to finish our trial, but we're hoping to be able to make it available soon. When we're done the trial, then we'll be able to start offering it to other people. So if you're interested, send us an email at the address that's there, and we'll put you on the wait list for when the program becomes publicly available. I'm mindful of time. There's a number of people that need to be acknowledged, and I'm going to make sure that I take the time to acknowledge the patients who have provided a tremendous amount of input into the development of this program, and all of the study participants who have been completing these questionnaires for 5 years, and all the other people to be acknowledged are on this slide. Thank you.
Dr. Lakai, thank you very much for sharing with us your very impressive work about work. Living with inflammatory arthritis, as you've stated, it's a challenge to start careers and to maintain those careers. And we really appreciate, you said that this has been happening over a long time period. Do you want to share with us when this began?
This began 20 years ago when I was still a student, and I started to be interested in understanding the issue, and started off with some studies to better understand what is the impact of work on arthritis and what are the predictors of work disability. And then I just felt, well, okay, there's all this research examining this, but there's no research doing something about it. And that's when I decided, okay, we got to do something. We have to develop a program. And so the very beginning of this was 20 years ago. It's not been 20 years to develop the program, but it has been iterations of it, testing of it, and then getting funding for this trial, and then this recruiting and following people for 5 years. So there's been a lot of rigorous research about this program.
Well, they say the best things in life do take time. So thank you. I noticed that we've started to get some questions in the Q&A box. And if it's okay with you, I'd like to share some of those questions. So first of all, Lindsay says, thank you. I'm so excited to see the results of this program. Lindsay says that she's now working for a benefits provider and would love to be able to offer it. Oh. Would there be a cost for people to sign up? And did you look at results by professions, teachers, people with office jobs, etc.?
Well, thank you, Lindsay, for this comment. And can I ask you to send an email to that email address that we mentioned? I would love to speak to you. As we are looking at how we can disseminate this program, we have definitely been in discussions with insurance company, health benefit plan providers, and we definitely think that this is one way to get this program out to the people who need it. Yes, there is a cost, partly because these group meetings, there's a facilitator, even the online program itself, the technology, by the end of the time we finished the trial, the technology was obsolete. We had to rebuild it. So we have to build in some cost to be able to maintain this program, both in terms of the content being still up to date, but also in terms of the technology. But our goal is to make this program available to as many people as possible at a cost that allow us to recover and keep it alive. So that's part of what we're working on right now, is the business model of how we can disseminate this. But I'm extremely interested in talking to people at the level of health benefit plans, because I think this is definitely one place where we need to make this program available.
Yes, it's exciting to see that question in the chat box, for sure, in the Q&A box. I noticed that a couple of people have asked questions about the email address. So if I can ask those who are kindly supporting us, if we can put up that email address again, I think that will be helpful.
And maybe also put it in the chat, maybe? Or
yeah, I'm not sure actually if the chat has been
I see.
for this.
Okay.
So we'll for sure put it on the webpage, definitely. Another participant said, thank you for the presentation. Do you have data or can you speculate, which is always much more fun than data, about which aspects or components of the problem of the program have had the most impact on improving productivity? Is that something you can speculate on?
Yeah, so this is really interesting. And we struggled a lot when we designed this, the trial to, this is obviously quite what we would call a complex intervention. There's many bits to it. There's the module, there's the group meetings, there's the, could we get away with something simpler? And what does each bit of this really contribute? And, as a first pass, we just needed to show, does the program work? And does it do what we want it to do? And we weren't really able to evaluate which part of it helps and which part of it is essential. I think that'll be the next steps in trying to understand, could we do just the online modules without the group meetings, and how would that differ, and what contributes to what? So, Allison, you like to speculate?
Opportunity.
Exactly. So I have, many more years to be try to figure this out. It's hard for me to speculate. I honestly, and I may be too vested in this. I think all of it is necessary. I think that and definitely the online modules, but also the one-on-one consultations, because I think people need some guidance in knowing what to do with all that information. So I don't think I can pinpoint to one thing, but I would say a big component of this is looking at job accommodations and what can people do and what can people change on their own. So because the word job accommodation is a bit intimidating, but what can you do in your day-to-day at work to be proactive and to anticipate problems and to make changes along the way for this to be a more successful experience for everyone and to live well with arthritis at work. So I think that's the how we get there. But I think if I had to pick, what do I speculate is the essential element in this cocktail? I would say it's really providing people the knowledge, the skills, and the confidence to be able to make those changes and request the support they need when they need support.
Well, that was a perfect segue into the next question, actually, because this question from Kelly is about the job accommodation requests.
Yes.
And Kelly wonders what your study found in terms of patient experience making those requests for job accommodations. Were there barriers that were encountered? Did it seem to make a difference by the size of the company or their understanding of arthritis? Is there anything that you can share in that respect?
So this is an excellent question, and certainly requesting job accommodations is a very difficult and intimidating process for workers with arthritis. We have not looked at that data currently in the trial, but I can answer some of this based on the work we did before developing the program, because this is what informed what we decided to put in the program. So in focus groups that we did, so these are group discussions with workers with arthritis, and when we first we did a pilot testing of the program with a lot more in-depth questions to people. Did you implement the changes and all of those, some of those questions that you just asked. And in that pilot testing, we found that I think it was 80, I'm going off the top of my head, I think it was 86 or 87% of people who did the pilot testing actually requested a job accommodation and after attending the program. And the majority of these, and I think it was over 75%, actually had implemented or been able to implement at least part of that. There were challenges, and one of the things that we realize is this all takes time, and this is why we need a long horizon to evaluate this, because we in our pilot testing looked at at things at like 6 months and a year, and people were still making changes at 1 year. So change happens slowly, it's a process. And it takes time. And in our focus groups, initially people told us, I know I need to make changes, but I don't know where to start. I don't know how to do it. I don't know what's available, and I don't know how to go about it. And this is why in the program, in a way, we kind of coach people through this process. Identify what you need. We give people like a little cheat sheet, if you want, about what do you need to do before you meet with your employer or your supervisor. Make sure you've done your homework. Make sure you approach a problem with a solution. Make sure you've looked into solutions and you have more than one suggestion. Think about what's essential to you. Where's your stop? What's nice to and what's essential. And then we give this DESO script as a way to ask, which is as a lot of evidence in communication, and we applied it to this setting to really give people a structure. And we also encourage people to practice it before they meet with their employer or supervisor, so that you're not so emotional. You've kind of practiced it before and you're ready when you go in.
This sounds fabulous. It's like a roadmap, step by step, personalized for individuals to make the changes that are most relevant to their kind of work. And there was a question related to that. Were the results broken down by the profession, like teachers or office jobs? Was that factored in?
Yes, I'm sorry. Now I remember the first question had that part of it, and I remembered I forgot to answer part of it. So we've not looked at that yet. So, with a randomized trial, you first just get your full results. Then you're allowed to do some exploratory additional analyses by subgroup. So we've not looked at that yet. I can say that but I do know that just from some of the feedback we got from people, that the people who benefit the most from this kind of program are people who are in jobs where they have a certain amount of autonomy on their job, and that they have a certain amount of flexibility in how they do their work, when they do their tasks, because this is one of the things we talk about, break up your tasks that are physically demanding or that are difficult for you, alternate them, etc. Or, so the very manual, physically demanding jobs where people have no control, those are more difficult and may not have the same success. And in fact, when we look at all studies that have looked at employment and arthritis, we see that the number of people in these jobs decline over time, because people usually have to transition out of these jobs. So most of the people enrolled in the trial had office kind of jobs, a lot of them in like the either, yeah, sort of, yeah, office. And we do have the job type and the breakdown, and it's not off the top of my head, but that's the majority of the types of job, administrative, office. But we have some people in service, some people in that are teachers, and it just from the feedback, it was definitely more of a struggle for these people to be able to make changes.
So there's certain characteristics of different
Yes.
types of jobs that one can have more room to make
Yes.
changes or accommodations in. While we're speaking about accommodations, do you have examples of accommodations that people can ask their employer for? Things like standing desks or design of keyboards or,
Yeah.
yes.
So, you know, often when we think accommodations are quite a wide range of possible things, and some of them, like the examples you've given, are more ergonomic. So it's making sure that your workstation is well adapted to your arthritis. And we have to be careful because sometimes what a person with arthritis need may be different than other workers. So, you know, it can be modifying the keyboard, it can be using voice recognition, a sit-stand desk so that people can alternate between standing and sitting. So those are the more ergonomic things, making sure that simple things as well, like making sure that things are all within your reach and you don't have to get into awkward postures to reach things, or using dollies and trolleys to carry things, you know, things like that. But there's also more about how your work is organized. So it can, or your hours of work. So it can be, if the morning commute is really difficult for you, and I mean, I know now a lot of people are working from home with COVID, but let's sort of, if we forget about this, you know, before that, commuting was a huge issue for people. We know that mornings are difficult for people with arthritis. They're stiff, they're sore, and to have to get up in the morning and stand in a bus for an hour, or stand behind the wheel of your car in traffic for an hour, people would arrive at work exhausted, sore, and this. So switching your hours so that you start a little later, end a little later, at least some of the days of the week, if that's possible, is an example of a job accommodation. It can be trading certain work tasks. You know, are there things that are difficult in your job description, but can you think of other things you could do instead so that you trade as opposed to reduce? It can be, you know, working from home some of the days of the week so that you don't have to do that commute every day. So it's a really, really wide range. We have to think of this in a very open-minded about anything that relates to how you do your job.
Thank you. It certainly seems like, you know, there's different kinds of categories. So there would be things that are equipment related, and things that of when you do your job or how you do your job, or could you do different tasks within your job? And it kind of highlights to me the importance of having that counseling as well, and the conversations and hearing ideas with others in the program, those sessions. That's what's going through my mind as you're describing that. Some of those accommodations that you're describing, they rely a lot on the employer. And one attendee today has asked, you know, with equity on everyone's minds these days, did the participants in the study make any comment about their employers' struggle with trying to make concessions for them or accommodations for them while still being perceived as fair to the other employees? Is that something that you've heard about in this work?
This is something that came up a lot, and it came up a lot even in the focus groups before we developed the program, that people were often afraid of accessing certain things that would be available, or making a request and then being perceived as being treated special, and that this would be unfair, and that it may attract resentment from coworkers. Why are you getting this and I'm not getting this? So, you know, this is commonly a concern of people and a barrier to asking for job accommodations. I think what I want to say about this is I mean, I'm not going to deny that this is a reality and some people may react that way, but at the same time, I think the changes we are seeing in the labor force, in the employment field now is a much greater willingness to, in the part of employers and workplaces, to accommodate people's differences, and employers who have that mindset, and it doesn't matter what like, you may have needs that are different than your coworker because of your arthritis. And another worker may have needs that are different than you for another reason. And there is a much more openness to recognizing that workers have individual needs, and that providing more flexibility and responding to people's individual needs is better for everyone overall. And it's a little bit like this equality versus equity, that picture that you see of everyone with the box, so giving the same treatment to everyone so that it's equal and quote unquote fair actually is not fair, because it doesn't lead to the same outcome for everybody, and that giving to each what they need based on their situation is a much more fair approach, and actually is more what equity is all about. And I think that people don't like to be treated differently, but maybe a way of thinking about it is, well, this is what I need for my arthritis, and other people have other needs for other reasons, and we all have individualized needs at the end of the day.
Thank you. I noticed there's a couple questions in the box that perhaps are more general. So for example, one individual asked, and maybe some clarification would be helpful here, you're no longer looking for participants for the study, correct? You have
That's right. Yeah. So we've recruited everybody in this trial. However, the research isn't done on this. So if you're interested in future studies that we might do with this, feel free to send your name on that email. We're always happy to collect names because there is more work we will do with this program. So yeah, and then in terms of if it's because you'd like to take the program, also send us your name, because when we open it up, then we'll be able to contact you.
Thank you. We don't have too much longer for questions because we did want to show a video. So we have about another 5 minutes for questions. So those of you that have a burning question, feel free to put them in the Q&A. But I'm wondering, there's a few questions in relation to, is there a legal obligation to tell your employer about arthritis?
That's a really important question, and it's a question that we often get asked, and that is also discussed in the program. So if your condition does not interfere with your ability to perform your job, you have no legal obligation to disclose. If, however, and this often comes up at the time of an interview, if you're, in an interview for a new job, do you need to tell your employer? So if based on the information you have about the job description, you don't think it'll interfere with your ability, you do not have to disclose. And we do not recommend disclosing at the time of a job interview, because you never know how it's going to get used against you. If I should say, if it may affect how you do your job, you can still say so, but you may choose when you will disclose. So, you don't need, it can be once they've given you the offer, then you can say, I just want to let you know that I do have this disease, but I'm well controlled and I don't think it's going to affect how I can do this job. And then, you might feel, okay, well, I'm upfront and I've let them know before. But, then if they withdraw their offer, then, this really looks like discrimination. So it's a way of kind of protecting yourself, deciding when you might say so. And yeah, so you're not legally obliged if it's not affecting your job. The other question you have to ask yourself is, when is the right time, and what is the advantage of telling so if you are starting to have some issues at work because of your arthritis, and you think it's affecting your performance, or you're saying no to things that you would have otherwise said yes to, and people are going to start asking, well, what's wrong? Like, what's happening here? This is when you have to start weighing the pros and cons. And I'm not saying that's when you have to, but you have to realize that when people are starting to have questions, they put their own answers to those questions. So you have to ask yourself, do I want to give them my answers, or do I want them to have their own answers? Or, when you're denying yourself access to things that could provide some support and help you, then that's when you also have to do that weighing. I'm giving up this potential support in order to keep my shield. Is it worth it? So there's no right or wrong. There's no definite answers. It's all about weighing pros and cons and figuring out the right time, and also figuring out, who do you disclose and what do you disclose? Not an all or nothing thing.
Yeah, this discussion is certainly highlighting to me the value about having those discussions with people who have knowledge in this area, but also other people who are experiencing similar situations, because there are pros and cons.
Yeah.
So being able to weigh those in an informed way is very helpful.
And people have shared negative experiences with disclosing. So I don't want to downplay potential consequences.
Okay, I think we have time just for one more question. Generally, do you feel that it's better to work part-time or full-time with arthritis? Is that something that you can generalize or not?
So reducing the number of hours from full-time to part-time is a common way that people have adapted or made changes in response to working with their arthritis. And for some people, that's the right thing for them. For some people, it gives them enough time for self-care and for the other things, and to be able to juggle and have everything in balance in their life. But I don't think I can generalize and say this is the answer for everyone. I think some people are perfectly happy and working, and that working full-time works well for them. So again, it is a common adaptation that people do. And it certainly is better that than hanging in there until you can't and then quitting totally. So something to consider. It does have implications. Not everybody can afford to go down to part-time. So a possible solution, but not a panacea.
Okay, so an option. But thank you for raising the financial aspect of part-time, because that was another question that was in the chat box. Well, I just want to thank everybody for their questions. I'm afraid we aren't able to answer all of your questions at this time, because we're excited to be able to share with you the video from this episode on Arthritis Research Canada Education Series. So I'm going to ask if we can now watch the video, and then we'll come back after that.
I think there was a period of time when my disease was at my worst, when I did leave school. I wasn't sure how I would come back to school, how I would go back to a post-secondary institution full-time, let alone work full-time. It did seem quite overwhelming and quite scary to think about potential limitations for my future. I'm Maya. I was diagnosed with rheumatoid arthritis in grade 12 when I was 17.
Often people feel really discouraged when they're first diagnosed with a disease like rheumatoid arthritis. In terms of their work, they're really worried that they're not going to be able to work. But it's important for people to recognize that they can have a fulfilling work life. Making It Work is an online program that we designed for people with inflammatory types of arthritis who are currently working to help them address the challenges that they encounter at work due to their arthritis.
I think for any young person, going out into the workforce at the beginning of your career can be quite anxiety-inducing. You know, there's lots of concerns and unknowns. So of course, having a chronic disease like arthritis does understandably, I think, add to those concerns, which is why having access to a program like Making It Work at this point, like I am at the beginning of my career, is so critical.
And our goal with this program is to help people maintain employment, but also live healthy and productive lives at work. So it's not about working at all costs, it's about breaking down those challenges, giving people the tools, the knowledge, the strategies that they need to be able to deal with employment issues.
You never really know how an employer is going to perceive, or how coworkers are going to perceive, a rheumatoid arthritis diagnosis. I think the ultimate goal is to be able to protect my career growth as well as my health.
20 years of research have gone into developing and testing this program, and patients were involved every step of the way. It's an entirely online program. It combines modules that provide information to people with arthritis on topics related to arthritis and employment. It also combines this with online group meetings where people can benefit from sharing their experience with others who have lived a similar situation.
Throughout my journey, from that really low point that I was at, where I had to leave university and my disease activity was quite severe, to where I am at now, I have also seen people like my mom, who also lives with rheumatoid arthritis. I've seen their diseases become so well controlled. So to be able to perform well in my work and to move up within an organization or company that I'm working for to reach my career goals without it leading to a huge flare of my disease, and without it sacrificing all of the progress that I've made in my disease management over the years. And it's so validating to be able to share your experience with somebody else who understands it and have them say, I know exactly what you mean, I feel the exact same way.
So I just want to thank everyone who has joined us today and those that will be viewing this in future. We hope that you found this webinar informative and helpful. We'd like to thank our sponsors for our Arthritis Research Education Series for their support. So Organon, Fresenius Kabi Canada, Gilead Sciences Canada, GlaxoSmithKline, Novartis, and Teva Pharmaceuticals. We'd also like to give a special thanks to our presenter, Dr. Diane Lakai. We're really grateful to have had the opportunity to share your research on this very important topic. We hope you've all enjoyed the video. I encourage you to visit the landing page when you have a chance, because it offers so many helpful resources. And one of the questions that we didn't address today are about some of those resources. And the reason I didn't ask it is because they're all there on the landing page for you. So please take a look at the web page when you have an opportunity. The recording from today's webinar will be available on the website, and a link will be provided to you. And as soon as this webinar ends, we'll send a quick survey, and we'll hope that you provide your feedback, because it's very important for us as we shape upcoming education series and learn what's important to our viewers. So thank you again, and enjoy the sunshine.